Hello, my name is Dr. Greg Vina, and this is a morning edition of Evening Rounds with Dr. Vina. This morning we're going to talk about your acute rehabilitation stay. And if you're a spinal cord injury, I hope you took my advice and went to one of the model centers, model spinal cord injury centers, which is the Center of Excellence for Spinal Cord Injury. Again, you'll have in review. You'll have several choices of where you may go. You might go to an acute rehabilitation facility in your local town, where they provide services such as physical therapy, occupational therapy. If you've had a mild brain injury, speech therapy. They might have recreation therapy, and you will get probably between 3 and 4 hours of therapy a day. Hopefully it will be individualized therapy, not group therapy. If you're a spinal cord patient, you really need individual therapy to get better. Or you hopefully took my advice or the advice of your treating physicians, or done research yourself and got to a spinal cord center, where often generally there'll be a whole floor of spinal cord patients in various stages of their recovery. There will be quadriplegics, paraplegics, cauda equina patients, complete injuries, incomplete injuries, a whole variety of spinal cord patients. Also on that floor will be patients who've been spinal cord injured for quite a while with complications related to their spinal cord injury. And there are a lot of complications, medical complications to different organ systems that occur with time with improper management, and these patients often go to these spinal cord centers for treatment, since again they are the center of excellence and the best physicians are practicing there. The specialists who have interest in spinal cord injury are practicing there, and hopefully again you've gone to a model center. I've practiced at both. I trained at Texas Institute of Rehabilitation Research, which is one of the top 4 or 5 rehab hospitals in the country. And I've been in private practice. Worked at Health South, and which is the largest rehabilitation provider in the country, as well as Life Care, which is a long-term acute hospital. Again, you've gotten into your rehabilitation hospital, and you'll hear this word early on, and I hope you don't hear this. It's called length of stay. Length of stay can be thought of in 2 different ways. If you're at a facility that looks at your diagnosis, goes to a book, the payer source, and the payer source says you have this many days to take care of your patient, and you need to be within this geometric mean, you will get your full payment. I don't like that way of looking at length of stay. The way I look at length of stay, the best facilities look at length of stay. The facilities that aren't interested in the financial aspects of medicine, but the caring aspects, you determine the length of stay based on what the goals are for that patient. If you have a young man, a 20-year-old motor vehicle accident, who's had who's a complete para from T6 down, with no associated injuries, you want that young man to be absolutely independent with his care when he leaves. You want him to be fully educated in terms of the management of his bowel, his bladder. You want it to outline what is going on in the future in terms of vocational rehabilitation efforts, driving evaluations, various assistances that are available for people with disabilities, so that in terms of education, so this young man can live a full life. If you're a high-level quadriplegic, you're on the ventilator. You're a C5, 6. You had chest trauma, you have pneumonia, you have a tracheostomy. You could be in the hospital for 6 to 8 months. Half of that time will be handling medical problems and building up your stamina so you get off the ventilator. Then is the rehabilitation efforts of getting up out of bed. You might only be able to get out of bed for 5-10 minutes at a time because of profound effects of deconditioning, laying flat for so long while the doctors are trying to take care of all your medical needs, your fractures, your brain injury. Length of stay clearly needs to be determined by goals, and the way the best rehabilitation hospitals do this is that once a week, the whole team, the physician, the case managers, the physical therapist, the occupational therapist, the speech therapist, the recreational therapy department, the psychologist who is assessing for brain injury or depression. We all get together, sit down, and talk individually about what needs to be going on in terms of that patient for the next week, for the 2 weeks down the road, and what we expect that patient to be able to do at the time of discharge. And then we're planning on what will happen after discharge in terms of what type of therapy, what type of social service, what kind of house renovations, what kind of what kind of training for the vehicles. Does the patient need a van with a lift? Does the patient just need hand controls? What kind of training does this patient need to do? And then all the education that's involved. The worst thing that could happen is a patient not understand how to take care of themselves. They go home, they get a gigantic decubitus ulcer on their buttock, then they're looking at another 3 months in the hospital to manage that. Education is key for both the family and the patient, so that this patient has as little complications as possible, so they could get out of the hospital healthy and pursue life. Length of stay needs to be based on goals, not an arbitrary number that is determined by payer sources. Again, I feel strongly about that. And any questions, I'm here to help. I'm Dr. Greg Vigna. I'm a board-certified physical medicine rehabilitation specialist, certified life care planner, and a personal injury attorney with a law practice in California. You have a good evening or good morning.